Medical professionals of Reddit, when did you have to tell a patient I've seen it all before to comfort them, but really you had never seen something so bad, or of that nature? I was the patient actually. I was sideswiped by a car, then ran over by the truck behind while cycling to work. I was essentially impaled by my right femur, which shattered my pelvis and shoved bone fragments into my guts. Last thing I remember before I got knocked out for surgery was the surgeon telling me everything was going to be fine, and it was all routine. I didn't wake up for a month. When I did, I was missing the entire left leg and most of the muscle tissue in the right. I was too weak to move much, couldn't talk because I had a tube through my neck, and I was very uncertain about reality due to what I went through in my coma. Parades of doctors came to tell me how I should be dead, and it's crazy that I lived. I was told over and over that my survival was very much against all odds. My surgeon, on the other hand, never said anything like that. He always maintained that he was going to get me through. His attitude honestly helped when I had to go back to his table a few more times before I was done. For 4 years, I kind of blew off the people who made a big deal about my survival. I adopted my orthopedic doctor's attitude. Then I met a woman who's in the medical field. I fell in love and eventually trusted her enough to let her read my medical records. I had never read them because it's a massive pile of paperwork. She broke down crying and couldn't read anymore. She told me that the beginning of my time in the hospital was full of the type of write-ups you find in the morgue. She told me that when they opened me up, bits of my pelvis fell out. I asked her to stop there. She won't read anymore, and I don't want to know anymore. I now know my doctor has one heck of a poker face. In 2011 I had a saddle pulmonary embolism 2 weeks before my scheduled wedding. My quite seasoned heart surgeon seemed pretty confident that I'd be okay, and he even said he'd get me to my wedding on time. Long story short, I was in the hospital for about a month due to complications. Several weeks later, when I was visiting my heart surgeon for a follow-up, he told me he'd only ever seen 2 other people as sick as I was. Those 2 didn't survive. Third time's the charm. I worked as a tech in the ER for a while and had a woman in her 40s present with burning and pain down below, discharge and a bad smell. I got the cart set up for her examination of her lady bits, got her vitals, blood and urine. She couldn't pee because of the pain, she said. All the basic jazz you do when someone comes into the ER. I process my samples and let the nurse know everything is done, and she goes to talk to the woman and it essentially goes as this. No, she hasn't had any trauma. No assault. No, she doesn't know what's going on. But it started about 3 weeks prior. Long story short, we get the doctor as the woman refused to let the nurse take a look. And we are all in the room when the doctor turns the light on under the drape and immediately asks if she's been using any medication through her lady bits. There's clearly a lot of irritation and swelling as well as a very strong odor, and she hadn't even inserted the spec yet. The woman says no, nothing. At this point the nurse goes to get some saline and I'm left to hand off tools and handle any swabs. The first swab handed to me was literally tinged a pale green. Clearly infection. I'm capping it and the woman smells the odor slowly filling the room finally and starts apologizing. I had to say while trying not to gag, no need to apologize. I've seen much crazier things. Just relax and we will get you all fixed up. Well, the nurse comes back with saline and the doctor starts essentially flushing this woman's glory hole, trying to clear out all this discharge and infection so she can see what's going on. And all of a sudden she stops and asks if she's sure she hasn't been putting anything in her fanny to treat any medical condition, even something not given by a doctor. And that's when we found out for about a month, this woman had been douching with a bleach and water mix to try and cure a yeast infection. Because she read that in hospitals we wash down with diluted bleach to kill germs and thought it would work. She was riddled with chemical burns and infection and was immediately transported to a bigger hospital. So yeah, that happened. I mean, yes, Monistat is uncomfortable, but that's a heck of an alternative. I'm an oncology nurse. The other day I had a patient who had a nosebleed that just would not stop. I gave him an extra infusion of platelets, vitamin K, and multiple doses of Afrin nasal spray which vasoconstricts. It would stop for maybe 20 minutes before it would start bleeding like a facet again through the family's pinching fingers. The whole time I was nosebleeds are common. It is the dry air from the heater act. I ended up personally holding his nose for over an hour while straight we waited from someone from ears, nose, throat to show up to pack it. He lost so much blood he needed blood transfusion. My arm was so sore and the patient looked like he had been murdered twice over from all the blood on his clothes. Not a medical professional, but my mom is an RN, and boy has she had some stories over the years. Yet, one in particular stands out. She had a male patient come in with an extremely swollen dong, like the size of a Pringle can swollen. She said it was the biggest dong she ever encountered in her decades as a nurse. He claimed he broke it during freaking. She had to put a catheter in. The guy was freaking out and she had to reassure him that this was a walk in the park for her. But she was seriously questioning how to get the catheter in. She called in her co-worker to help steady his dong. Well, also so someone else could just witness what she was seeing, while she gave him every painkiller she was legally able to give, and stuck the catheter in. Got it in the first try, thankfully. She still doesn't know how she managed to get it in, but was thankful she did, lol. Eventually it came out that he hadn't broken his dong during fricking but actually masturbated after cleaning his fish tank without washing his hands and got an infection from it. When you empty a fish tank you use a suction hose that functions eerily similarly to a dong pump, and I bet that is the real story. I am a surgical tech. I got called in on a Saturday for a lady who had an infection from a component separation. Basically they put a giant piece of mesh in you for hernias. I wasn't prepared. When we lifted up her gown, the smell wafted and I have never almost puked before until that moment. About 20 centimeters circle around her umbilicus was black and necrotic. It was absolutely awful. We basically removed the entirety of the necrotic tissue all the way down to the peritoneum. Just grey and black slimy mass of fat and skin. The worst part is that I had to measure the necrotic tissue and it requires me to lean in a little close to it. The surgeon was laughing because I was green when I got back to the surgical field. Then during that surgery another person who had the same procedure had come to the OR with an infection. And then a third. We stopped using the mesh because that's what was getting infected. And now there are commercials in late night sketchy TV all about lawsuits for medical meshes. I had to see an orthopedist oncologist because I had 2 sarcomas, one in my left thigh and the sciatic nerve and one in my left pelvic. My surgeon said he would get both out and the most I would get would be a drop foot, where you can't lift up your foot on your own. I went back 2 years later and my doctor told me he thought he would have to remove my leg because of how the sarcomas were enmeshed in my bones, muscle, and nerves. I honestly thought the whole time that it was an easy out, though the 2 10-hour surgeries may have been a clue that it wasn't so simple. These days I have a limp as I'm missing half my left pelvic bone and most of my glute and thigh muscle, but I got to keep the leg. A patient with rectal cancer with an exposed colon and rectum. I could see her tailbone and in the head of the femur, and whenever she would poop, it could collect inside this open cavity and had to be flushed out. I had one like this. He was living with his brother's family. They fricking left him to go on vacation, came back to him laying in a puddle of crap pee on the kitchen floor 4 days later. I made them sit in the room while we cleaned him. He died not long after. Some days I fricking hate people. When I was a med student on the trauma service, there was a gentleman who decided to attempt suicide using a shotgun aimed at his heart. Unfortunately, the first thing that comes out of a shotgun when it is fired is a gust of air, which changed where the gun barrel was pointed when the shot came out. The shot pellets ended up hitting everything but his heart, lungs, ribs, spleen, stomach, liver, pancreas, and large and small intestines. In the OR, the attending surgeon told me to put my hand on his beating heart because that will likely be the only time in my medical career that I would touch a beating heart. I did. It was cool. In case anyone reads this in a thread with 1,500 plus posts. He survived, though. He was on the trauma service for the entire month I was there, and was in the hospital for a long time further. In case anyone reads this in a thread with 1,500 plus posts. He survived, though. He was on the trauma service for the entire month I was there, and was in the hospital for a long time further. Medical science and the people that work in that field are amazing. Not my story, but my so was in training as a nurse's aide. On her first internship, She was assigned to the Irritate Trauma Center, the first person. On her first shift of her first internship of 3 was an older homeless man, complaining of his foot hurting. After the medical staff took a quick look at the foot, they didn't initially see anything wrong, so they tried to remove his pants to examine the leg. The pants didn't move. They were fused to his skin from the middle of the hip all the way down to his calf. They had to surgically remove his jeans by basically cutting the skin around the point where it was fused. At the moment the scalpel made the first incision, she described it as if Slimer from Ghostbusters barfed out of his leg. Apparently, there was enough gushing, green fluid, filled with maggots, that it covered the floor in the small examination room, and the nurse ran out of the room gagging. After getting over the initial shock, they managed to peel a good amount of the skin off with the pant leg, and revealed that his lower leg had basically rotted all the way to the bone, and was full of maggots. Apparently that's the moment when she knew she was meant for the job. Even the surgeon was having a pretty hard time keeping his composure, but she was fine, more fascinated than anything, and apparently not affected by bad smells as most people are. They had to tell him his leg was going to be okay. He was severely mentally ill and might have freaked the heck out, despite knowing he could die from the infection. Apparently he survived and they managed to save the leg, which is beyond incredible. What the frick, JPG? 4th year med student here. On my rotation a couple months back, I walked into the ED and was immediately asked to help a nurse and resident put a catheter in a patient. And now a catheter placement is usually a one-person job, so I was pretty confused as to why they needed my help. I walk into the patient room, and I'm immediately greeted by a disgusting rotting flesh smell. Worst thing I've smelled in my life. The patient is to be pushing 400 pounds and has the worst edema, soft tissue swelling, from congestive heart failure I've ever seen. His scrotum and penis foreskin are about the size of a small watermelon, and the foreskin had swollen completely over the tip of his dong. The nurse had a speculum, tool OBGYNs used to look inside glory holes, inserted into the man's foreskin while the resident took the catheter in a hemostat, pliers type thing, and jammed it into the man's pee hole for 20 minutes. They finally got the catheter in and took the speculum out. It was covered in a thick brown discharge that looked like fermented pea crap. I still don't know how he let his scrotum and dong swell that much. We comforted the patient the whole time and kept telling him we had done it like this before. Total lie. No one in the ED had ever done or seen anything like it. Not a doctor, but had one that defiantly lied to me. So I have an extreme reaction to poison oak. After a day my skin literally starts slugging off, exposing the fatty tissue. It then starts growing away from the contact point, doubling in size every day until I get treatment or die of infection. Day 1. Man, this poison oak is itchy. Attempt not to scratch, but you do. Day 2. This is bad. I must have an infection. But I did everything I could to keep it clean. Call the doctor. Make appointment for Monday. Day 3. Wake up Saturday stuck to my sheets because the gauze is too saturated to contain my body fluids. Make an urgent care appointment, but make it for the afternoon cause I got to see the kids' soccer game. Upside. It doesn't itch today. No pain at all. Doctor sees me, makes a phone call, tells me to sit there and don't move. An hour later, another doctor comes in wearing some kind of hazard suit. I start freaking out. He tells me he is a specialist dermatologist and has seen it all. Also comforts me by saying, worst case scenario, it's flesh-eating bacteria. The fact that you're not dead by now might mean you have superpowers. He starts to remove the gauze the previous doctor wrapped me in, and as soon as the affected area was revealed he threw up his hands and jumped back. Then says, he's not seen this before and wants me to describe everything in detail. He takes swabs, sends to lab, prescribes me steroids and antibiotics, brings me the prescriptions, and after sitting in the little room for a total of 8 hours lets me go because I've stopped leaking. I saw him again on Monday and the labs had nothing terrible and I was completely scabbed over. He had me finish all the pills, saw me 2 more times, and I didn't even get any scarring. Just my body getting rid of the poison oak by getting rid of all the skin. Sounds like Stevens-Johnson syndrome. For God's sake, be careful. Other plants and drugs can do that to not only your skin but also your eyes and certain internal organs. Obligatory, not a medical professional, but a first aider. I was doing a duty at the finish line of the London Marathon, as I have done for many years. I've seen enough chafing, dehydration and blisters galore. Someone always has the worst of the day, but it happened so fast that you can hardly mentally tally whose nipples were the most raw. Until I had a runner come in covered in blood complaining that her nipples had completely gone. She had chafe so bad that her nipples and areolas were rubbed to nothing. And the worst part was that she had her nipples pierced and the piercings had embedded themselves in her exposed breast tissue. I had to talk her through sterilizing the wounds while trying to assure her that it happens to everyone. The image of a nipple bar peeking out of red, raw breast tissue will haunt me. I was a fat little 10-year-old with a slide on a float in the middle of the lake. We had a bucket on a rope to pour water on the slide before you went down. I missed a spot. My right nipple very literally was burned off by the hot plastic. It took years before became somewhat normal again. I used to do psychiatric evaluations in an emergency room setting. One time, I'm evaluating this 60-year-old woman who is lying in the hospital bed. I'm asking her questions, and she stops me and says, "Excuse me, but I need to pass some gas." I let her know that this is a medical setting and that is a completely normal body function and not to be embarrassed. People pass gas all the time. I was not prepared for what came next. She let it rip, and out came the loudest, wettest, and longest sounding fart I have ever heard. It was bubbly and juicy, hitting all the deep notes while ending on a squeaker. I don't think Satan could have made a noise like that with his anus. It sounded so relieving. But then the smell hit me. It was bad enough that I started to gag and had to excuse myself from the room. When I came back, I politely asked if she needed a nurse for anything in case she needed to be cleaned up after that, but she declined. Obviously I've witnessed people farting before, but I've never heard or smelled anything like that before. That was something else. Doc here, currently working with accident victims. I had a patient once hobble in, walking in his chelator, a week after being hit by a car. He'd been to the ER. They discharged him and said just the usual bumps and bruises. I did my round of x-rays, and his femoral heads were broken on both sides. Think of the leg bone as a capital L, with the bottom of the L hooking into the hip. His were cleanly broken through the bottom sections on both sides. Turns out he'd had occult fractures on both sides the x-rays didn't initially see, and walking on them collapsed them. Never seen that before. Another was a patient with shoulder injury, both sides. Got an MRI, and both shoulders were basically destroyed. Complete failure of the rotator cuff on both sides, with a humerus being drawn up and back on each side. Instant surgery. I'm a medical secretary for a podiatrist. I obviously didn't treat the patient myself, but I discussed his case with his doctor. The patient had severe anxiety and therefore hadn't been to a doctor of any kind in approximately 20 years. He ended up in our office because his wife had called the day before and expressed that he needed to be seen due to a foot infection. When he arrived, he approached the window and told the receptionist that he was sorry because his socks were dirty as he hadn't made it to the laundromat recently, which was a bit weird in and of itself, but we work for a podiatrist. We've seen it all before, as it were. He then sat in the waiting room, and it was mere moments before the smell seeped into the administration office. The receptionist put him in an exam room as quickly as possible, and upon her return, she informed me that the infection was literally oozing out of his sneaker. All we could do was open the windows and apologize to other patients as they arrived. It was foul, and when I entered the room after his appointment to clean it, the medical assistant was out that day. I immediately began gagging and had to forcefully push my manager out of the way as to avoid vomiting on her on my way to the restroom. As it turned out, the dude had had the infection for approximately 3 months and had been showering with his sock on since he'd discovered it. He literally hadn't removed his sock from his infected foot in 3 months, and his wife had somehow been living with the overwhelming smell. The doctor said it was the worst infection he'd ever seen, but the patient was so incredibly anxious that he got the standard "I've seen it all before" throughout his appointment. I was working as a CNA in a nursing home. There was a lady who had been neglected before she came in, so she had stage 4 bed sores, all the way to the bone, and the treatment nurse wanted me because I am calming and really good with the residents that needed a little support. She has me roll her on her side and then carefully peels back the bandage. I'm staring done in half horror half fascination as I can clearly see the bone, ligaments, muscle, layers of skin. I'm gawking hard and the nurse is showing me some neat procedure when I hear a small, frail voice. Is it getting better? I turn on my biggest, friendliest smile and reply, it does. It looks so much better. Does it feel better? She smiles and nods. I change the subject to grandkids. She had a picture of them. I haven't seen anything like it before or since. But she was such a lovely lady and I started looking forward to helping because she was such a nice lady to talk to. Thank frick there's nurses like you. Not the doctor, but the patient. In 6th grade, I contracted so many different forms of dysentery that I was placed into CDC quarantine while they tried to figure out where I got it. I was barely conscious throughout the whole time, but all I remember is my doctor in my room with me, having hooked up my Wii and playing Brawl as I recovered. I had no clue that my parents were being investigated for child abuse or that I was in quarantine until a few months later, or that I had passed out and had been covered in vomit and crap for hours before my mom found me and took me to the hospital. I ended up getting it from someone not washing their hands after handling a snake and then cooking dinner at my science camp. Wash your dang hands, people. I do work in the medical field, but I'm not a doctor, so technically I am a medical professional. The dang Oregon Trail over here. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.